Hi everyone, Dinesh Sirasena here, and today we're going to be talking about undertaking injections around the lumbar nerves. So remember, when positioning the patient, it's good to have them in a prone position with the hips slightly flexed. You can find out more about the positioning and the scanning of this area in my last video. When undertaking the injection, I typically use a curvilinear transducer, and that's because this gives me a wider field of view, and because of the lower frequency, I can see the deeper structures. I also use a 21 gauge needle. The reason for this is because of the depth of the structure. If you use a smaller gauge needle, it's much harder to control. When injecting the lumbar nerves, I usually approach it at approximately 50 to 60 degrees, depending on the habitus of the patient. You're aiming for the transverse process, and you want to guide the needle just beneath this. Sometimes, when you get the needle into the correct position, the patient may experience a sensation down the leg or into the buttock. So this is a diagram of what you're trying to aim for. In the midline, remember, there's the spinous process. As you move laterally, there's the facet joints. And as we move laterally further, there's the transverse process. Approaching from the head end, we're aiming to bring the needle just beneath the transverse process and through the ligament in between the transverse processes. Once you've achieved this location, as mentioned previously, the patient may feel a funny sensation down the leg or into the buttock. At this point, it's a good idea to draw back on the syringe, just to make sure that you haven't hit any vascular structures. And if that's okay, you can inject the solution that you want to inject. And here's a typical image of what you will see. So the transverse processes with the ligament in between, and you want to bring the needle just beneath the transverse process and as close to the midline as possible. Once you're in that position, draw back on the syringe, make sure you haven't hit any vascular structures, and then you can inject the solution that you want to inject. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging and interventions. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram, and remember to check out sportsmedinfo.sg.